Hi, my name is Missy Marsocci. I am the owner of a healthcare consulting and management company, which has provided me quite a bit of experience in hiring and retaining qualified staff in healthcare. Prior to owning a consulting and management company, I've also owned multiple urgent care centers for which I was also responsible for the hiring process, recruitment process there as well. So I hope my background and experience will bring you value as we go over this webinar on how to recruit and retain qualified qualified employees in healthcare. I'm just going to share my screen and so you can see the webinar. So bear with me 1 second. From the beginning. Okay, just as I mentioned, the webinar is entitled Recruitment and Retention in Healthcare. The healthcare administrators face many challenges in today's rapidly changing world, from an aging population to a shifting healthcare landscape to the threat of pandemics. One of their biggest challenges is the recruitment and retention of physicians, nurses, and other trained medical personnel. The growth of the healthcare job market is projected to outpace nearly all other sectors, according to the Bureau of Labor Statistics, adding about 2.4 million new jobs between 2019 and 2029. Until healthcare organizations adopt new approaches to talent management, patients are at an increased risk of receiving substandard care from overworked employees. For example, increasing a nurse's workload by just one patient increases mortality risk by 7%, according to research published in The Lancet. How can healthcare talent management professionals work towards a solution? Well, stay tuned to find out more. And in this recorded webinar, we will go over the following: sourcing, hiring, and new employees, training, educating, and getting new employees comfortable, managing, engaging, and developing employees. Okay, attracting quality candidates. Healthcare services on the backs of its workers. Healthcare survives on the backs of its workers. A hospital, a hospice, an urgent care facility, no matter what the healthcare role, without good workers, it's nothing. Recruiting healthcare workers comes with its own challenges and must be handled with a different approach than most other types of recruiting. The question is, how? Healthcare workers have a number of special considerations that you have to keep in mind when you're managing recruitment. Healthcare workers have an extremely high turnover rate. Healthcare is an extremely demanding career with patient lives on the line every day. It can be extremely stressful simply by the nature of the work. Add on to that administrative, governmental, and institutional shortcoming, and it becomes a minefield. Excuse me. The turnover rate for healthcare and related fields is nearly 20%, and that's before the current pandemic began pushing every single healthcare worker to their limits. Unlike many other fields where on-the-job experience or education rules the day and specific certifications are often optional, healthcare is strictly regulated. Healthcare workers require specific certifications or degrees for their desired roles. It's impossible to hire an untrained and unqualified worker for most healthcare roles, although lower level roles like receptionist, custodial staff, and food service are always available to nearly everyone. How can your organization attract quality candidates? Well, number one, you need to know who you're looking for. So start by looking at your successful current employees and try to figure out why they are successful. In the Rowan Report article, Retaining and Growing the Direct Care Workforce, Darcy Trescone advises, collect, store, and then mine the data you collect on your current employees to better understand who would make great candidates to add to your agency. Understanding where your best candidates come from will help drive investment into the right channels. Number two, know and define who you are as an organization. You are competing for qualified candidates, so it's important to distinguish yourself from the competition. This goes beyond branding. However, it is about an honest positioning of your organization's mission and culture. Your mission should define what you stand for and must reflect your agency's commitment to the community you serve. Make sure your employees are knowledgeable and supportive of your mission. According to Forbes, connection to the mission is commonly linked to why any given employee wants to work for the company in the first place. Nurture those reasons and unite them with the company mission. Number three, Be proactive. Using social media and recruiting websites is a necessary first step, but you can't just wait for people to find you. Recruitment in a competitive workforce market requires proactive and directed action. Many organizations are looking to retirees to help fill the staffing gap, hiring back known high performers in part-time or specialized roles. Provide as much information to prospective candidates as you can regarding available shifts and locations. Encourage your successful and satisfied employees to spread the word and find a way to acknowledge those who do. Consider rewarding employees who help with recruitment efforts. Seek out new graduates of training programs and certification courses. Get a first visit scheduled for new hires as soon as possible. Consider starting your own training program or certification course. Number 4, be competitive however you can. Direct care recruitment has always been challenging for hospice and HHAs, and compensation is one of the biggest factors and one of the hardest to address. Offering a competitive wage/salary is obviously the goal, but you should be competitive in any and every way you can. A good benefits package is a powerful draw, and some organizations have begun offering substantial signing bonuses for home health care nurses. Also consider, though, flexible scheduling, employee stock ownership plans, more frequent or flexible pay days. Number 5, market your organization. Online visibility and a social media presence are requisite. Make sure your website reflects your mission and culture. When you know who you're looking for, make sure you understand the diverse demographics of your ideal candidate. Remember that word of mouth from dissatisfied employees can quickly dispel any positive image you may be marketing. Number 6, stay technologically current. As the world changes, consumers and businesses are becoming more technologically savvy. In order to cut costs, maximize resources, enhance productivity, and remain competitive, tech-savvy candidates, and most of them will be drawn to tech-savvy organizations. Picking the right candidate. While the type of position and education versus experience debate contributes to prolonged job vacancies, the recruitment process itself is also to blame. While HR departments typically facilitate recruiting, individual departments usually hire candidates. This kind of multi-layered recruitment process makes HR document management complicated and slows employee hiring in healthcare. Cloud-based recruiting software helps managers centralize their recruiting strategies and streamline these kinds of hiring processes. A unified HR platform lets leaders across multiple departments utilize the same system for candidate recruiting, interviewing, and license verification. Multifunctional recruiting solutions enable HR managers to oversee individual departments' hiring practices. While HR gains visibility, individual departments can hire without the stress of process litigations. Department practices end up aligning with industry and brand standards. The result is a unified hiring and onboarding process across multiple departments and throughout the organization. Cumbersome screening processes are another recruitment selection challenge to HR and healthcare. While some screenings involve Social Security tracing and criminal history information, other background checks in the healthcare industry involve unique processes that don't usually apply to non-healthcare organizations. In addition to these background-style checks, a healthcare employee must have you take a tuberculosis test and verify if you have received other vaccinations relevant to the job. These screenings and health checks can take a lot longer if you don't have a system to properly manage prospect documentation. Pick an HR recruiting software that grants you access to the specific screening tools and document management capabilities you need for your healthcare organization. Automating this process eliminates duplicate data entry. As a result, HR recruiting software reduces errors associated with candidate screening, improves accuracy, and speeds up the entire hiring process. While recruitment, selection, and retention challenges in healthcare might be nerve-wracking, the good news is medical professionals and organizations worldwide are taking the necessary steps to help close the gap between HR and healthcare and minimize healthcare recruiting and hiring difficulties. Now that we cover the logistics, what should we look for in a healthcare candidate? And the healthcare industry, it is particularly important as companies set high requirements, but experience high turnover rates among applicants. To find qualified employees for entry-level positions, you need to balance what the position really requires with what's available in the job market. The first step to finding the right employee is knowing what resources are available to you. Too often, hiring decisions are skimped and stripped to find a new employee the cheapest way possible. However, employees are the greatest resource for building your organization, regardless of what drives your company. We like to remind our clients that recruiting is an investment. When it comes to taking advantage of resources, you need to understand what characteristics your ideal job candidate possesses. First, know which job qualifications are really important and which are simply preferred. Do not set education or experience requirements higher than absolutely necessary. Healthcare professionals' traits. Healthcare professionals possess several skills to do their job well. This can range from the way they communicate, their interpersonal skills, to the way they handle stressful situations. Here are 10 traits every great healthcare professional embodies. Number 1, excellent communication skills. These skills include speaking as well as listening. Healthcare professionals need to engage the patients to make sure they are sane and following directions to ensure the needs and treatments are understood. Number 2, emotional stability. It's not easy, but it's necessary that any outside emotions are left at the door and that the healthcare worker is emotionally stable while on the job. Things can get stressful, but it is important to make sure not to allow the personal stresses in, so not to cause personal harm to the patient. Number 3, empathy. Empathy is more than just caring for others. It's about putting yourself in the patient's situation to better understand their pain and suffering that the patient and their family go through. This can take a toll on the caregiver, but it allows for better health care. Number 4, flexibility. Healthcare professionals have to be flexible with their working hours and the needs of the patient. That might include weekends, holidays, and even overnight shifts. This isn't always fun, but most will say it's very rewarding to be able to help someone feel better. Number 5, attention to detail. Attention to details is so important. Even a small mistake can mean the difference between life or death. So while the job has a lot of stress and pressure, it's important to remember there are consequences for all actions or errors. Interpersonal skills, number 6. Having excellent interpersonal skills means working well with all kinds of people. That might include nurses, doctors, or other staff members and patients and their families. The patient and their family can be afraid or upset, but relating to and working with them makes a world of a difference. Physical endurance. A good healthcare worker will also have a strong physical endurance to tolerate standing for long periods of time and even heavy lifting. This also involves not being able to take a break, to eat, or use the restroom whenever the professional wants to. Number 8, problem-solving skills. Thinking outside the box and being able to figure out what to do after the traditional methods don't work is the difference between a good healthcare professional and a great one. Number 9, quick response. Being able to respond quickly to emergencies means being prepared for all situations. This includes having a disaster or emergency plan in place, participate in practice drills, and having first aid kits fully stocked and transportable. If one is looking for something specific, then the patient could die. A little extra preparedness now may mean the difference between life and death. Lastly, number 10, respect. Respect for patients' desires and wishes, respect for HIPAA regulations, and respect for different cultural traditions, which will turn a scary situation into a more pleasant one when everyone trusts that the healthcare professional will do what is right. Being a healthcare professional isn't an easy job, but it is a rewarding one, and having someone that embodies these 10 traits will keep the patients happy and their families satisfied. Maintaining quality employees. Once you've hired someone, the next challenge is keeping them. Never an easy thing in a competitive workforce market. Having an employee retention strategy is critical. Job satisfaction is obviously paramount, but staffing retention is about building trust and loyalty with your direct care workforce. In general, workers crave engagement, support, and growth for themselves and the company they work for. It all comes down to the work environment, which can include everything from staffing levels to staff support. Improving the workplace environment can not only reduce staff turnover, but lower costs and improve patient outcomes as well. Keep the following tips in mind. Number 1, focus on your mission of quality care. As mentioned above, your organization mission can be a strong recruitment tool. It is also critical to staff retention. Forbes says that promoting your mission to employees can increase their day-to-day engagement and promote a positive work culture. Number 2, be honest and follow through. Authenticity and transparency build trust. Communicate both employee-specific and organization-wide meeting. Honor the commitments you make to new hires regarding wages or salaries, shifts, and locations, and day-to-day work requirements. If you can't follow through on a previous commitment, make sure you communicate the reason why honestly and as soon as possible. Number 3, support the individual needs and circumstances of your employees. A 2014 study on why nurses leave the profession cited lack of support as a significant issue. Respondents described their managers' lack of support, unsupportive relationships within their work group, and a healthcare system putting business principles before care as factors resulting in job dissatisfaction and nurse turnover. Even before the pandemic, one of the biggest factors affecting staff retention were staffing levels themselves. Inadequate staffing increases employee stress levels and accelerates burnout. It is a vicious and seemingly endless cycle, but a supportive company culture can go a long way toward mitigating the stress and burnout that can cost your agency quality employees. Solicit and acknowledge employee input into quality care policies and procedures. Be responsive to employee issues and complaints. Be flexible as possible with scheduling to accommodate individual needs, preferences, and emergencies. Establish or strengthen your agency's employee support network. Number 4, recognize and reward good work. Rewards and recognition are crucial to staff retention. You don't have to have big recognition programs. It's about employees feeling cared for just like we care for our clients, said Stacy Buchler, Director of Employee Experience at Omaha, Nebraska, based right at home. Number 5, excuse me, offer opportunities for professional growth. Opportunities for education, leadership, and advancement can attract motivated workers and keep them engaged and invested for the long term. Focusing on quality and training can pay off in retention as well as recruitment by helping to foster a more involved and invested employee base. Consider offering advanced training and employee professional development opportunities, covering the cost of relevant continuing education and continuing nursing education, covering the cost of relevant certifications, offering compensation incentives for professional growth and development. Staff education can pay back in more than job satisfaction. It can also assure that your agency has the skills necessary to meet the increasingly specialized care needs of your patient population. Number 7, get creative. Organizations will need to get more creative about attracting and keeping quality employees. Wages aren't always the most powerful motivator in healthcare. As workforce competition continues to heat up, unique benefit offerings such as these may be necessary to attract and retain qualified home healthcare employees. Redefining training. Disengaged employees can drain the life out of an organization. Revenue drops along with productivity. Unhappy employees displease patients, which can swing reimbursement. Throughout the healthcare community, small groups of individuals work together as teams. Physicians, nurses, pharmacists, technicians, and other health professionals must coordinate their activities to make a safe and efficient patient care a priority. However, even though a myriad of the conditions addressed by healthcare professionals require interdisciplinary teams, members of these teams are rarely trained together, and they often come from separate disciplines and diverse educational backgrounds. Given the interdisciplinary nature of the work and the necessity of cooperation among the workers who perform it, it is likely that teamwork plays an important role in ensuring patient safety and avoiding errors. Teams make fewer mistakes than do individuals, especially when each team member knows his or her responsibilities as well as those of other team members. However, simply installing a team structure does not automatically ensure it will operate effectively. Teamwork is not an automatic consequence of placing people together in the same room. It depends on the willingness to cooperate towards shared goals. In healthcare, shared goals might include maintaining a patient's health status and avoiding errors. To ensure a smooth operation, you need to invest in training. Despite a busy and fast-paced work environment, medical facilities need continuous training for employees, particularly nurses, due to the following important reasons. 1, employee improvement. Training solidifies employees' existing skills and helps them improve in lacking areas. An effective training program spots individual areas of improvement in order to address them properly. This enables every staff member to be independently effective when it comes to performing their roles without relying on fellow employees who are more experienced with specific tasks. This builds the nurse's confidence, improves overall performance, and encourages cooperation as well as creativity to bring new ideas into the workplace. Safety and consistency. Aside from this, training also includes information about personal and patient safety practices. It reinforces consistency in hospital policies when all medical staff are aware of rules and updates for the hospital and the healthcare industry in general. Employee satisfaction. The feeling of being poorly educated is one of the reasons why nurses leave training. The reason of being poorly educated is one of the reasons why nurses leave. Training keeps employees satisfied as it leads to collaboration and cooperation among staff members. It makes everyone feel that they are valued and their contributions are acknowledged. Best practices for hospital training. Despite good intentions, hospital training programs are only effective through best practices. It involves a process which extends before, during, and after the training. The program should be designed based on 2 principles. It must cater to all types of learners and needs to be customized specifically for your hospital's system. Consider individual learning styles and employee responsibilities. Individuals vary when it comes to learning. Some best absorb information when it is communicated verbally, visually, or a combination of both. A quick survey should resolve this. If not, a thorough observation of how each employee responds to varying training techniques will help distinguish everyone's learning style. Training sessions should not affect staff members' responsibilities, particularly those who are assigned critical roles. It's best to schedule training during dead hours or in between tasks so as not to affect productivity, staffing, and overall patient care quality. Personalize the program for the hospital. Training programs must be personalized to specifically address the company's needs. Ideally, hospital staff who have direct knowledge of issues which may require more training should be consulted when developing a new program. Most readily available modules are too generic and don't concentrate on specific concerns. You may consider utilizing prepackaged modules, which provide opportunities to edit materials so you can include concepts that are relevant to the hospital needs. Incorporate interaction and technology. Attention span diminishes after a while, so extended training sessions should be minimized or made more lively with interactive elements. During the training session, include group exercises, games, role-playing, brainstorming, demonstrations, and other methods which encourage collaboration and cooperation among attendees. Don't rely on the usual lecture and discussion alone. Take advantage of technology, use new methods of teaching, including simulation labs and just-in-time training. Evaluate the program's effectiveness. A method to evaluate the program's effectiveness must also be developed. Training which doesn't improve employee skills or competency is a waste of hospital funds, human resources, and the employee's time as well. Key takeaways. Healthcare organizations are some of the largest and most complex in the world. Therefore, the different varieties of administration careers available in the field are growing both for seasoned workers and those starting new careers. Education is a critical component in the career of every healthcare administrator. Having a higher degree in healthcare administration will assist you in creating programs that will help your organization recruit and retain employees. So there's an opportunity to connect on social media if you're interested, both LinkedIn and Facebook with the American Institute of Extended Studies. And that is it. I just stopped my sharing. So thank you all for your time today. I hope that this was valuable, and I know that you can send in questions to AIES should you have any, and I'd be happy if they wanted to send them to me as well. I hope you all have a wonderful day. Take care.